Here. My name is Roger Bingham. I'm the director of the Science Network. This will be filmed, as each of the preceding stem cell meetings on the Mesa have been filmed, so I'm just giving you a warning about that. I've mentioned this before, but this is the 10th anniversary, so it seems reasonable to retell the story that this meeting evolved from the public launch of the Science Network, which was just a month before California voted on Prop 71. In 2004, and that meeting was called Stem Cell Science, Ethics and Politics at the Crossroads. And I worked with that with a number of people in this room, notably Larry Goldstein. I think also Rusty Gage was involved, Joe Panetta, the late Dwayne Roth. And this then became the Stem Cell meeting on the Mesa, which started in 2006. When I introduced Larry at that first stem cell meeting on the Mesa, he said, and I looked back at it last night, he said that he hoped it was the first of many annual exhibitions of not only our ability to work together, but all the wonderful things we're going to be doing together in stem cell biology, business, medicine, and ethics. I think that certainly proved to be the case. And actually, as we start, for his tremendous support, energy, and insights, I would just like you to acknowledge Larry Goldstein, please. He also then typically went on to say, as he introduced the first panel, I'm giving you 10.00 minutes to speak. I will stand up at 9 minutes, and at 10, if you're still speaking, the lights will go out. It was fairly typical. Larry. At the first meeting, we had people like Bob Klein, John Moores, Malin Burnham. We had a tremendous collection of rising stars as well. Zach Hall, first president of CIRM, who was here. First, he in fact noted the number of younger scientists that were on the panels, and that has continued to be the case. So a lot of the people who are in this room who are now running things actually started giving presentations at the stem cell meeting on the Mesa, including Katrina Jamieson, who's now running the Division of Regenerative Medicine, the first one, chief of it, at UC San Diego. Other folks like Alison Motrigino, Carl Willett, Adam Engler. I'm looking around to see who else is here, but a tremendous collection of people. So I actually don't want to go on too long because I've got a few other comments to make in between the other speeches. I do note that the Philosophical Transactions B of the Royal Society, the current issue, is a discussion meeting, Cells, from Robert Hooke to Cell Therapy, a 350-year journey, since Hooke was the first person who actually identified a cell, as it became called. And the speakers include Ian Wilmot, Irv Weissman, George Daly, a number of the people who've been here and at our stem cell meeting, so it's rather interesting. Although I must say, here's something that really surprises me. This is just a trivial point, but the Royal Society was founded in 1660, and they had their 300th anniversary in 2010, right? The stem cell meeting on the Mesa started in 2006. So you'd think the 10th anniversary would be 2016. In fact, it's this year. It's 2015. So I don't know how they compute these things, but I'd like to wish us all a happy 10th anniversary and introduce the current man who runs CIRM. Randy, would you take the podium, please? Randy Mills.
Hi, thank you, guys. I'm gonna try to do this quickly, but what I thought it would be fun to do, I've been at CIRM now a little bit over a year, and we've spent a pretty good portion of that time rethinking and reimagining how we could have the Institute be as effective as possible. And we're doing that in the launch of our new strategic plan, which will hopefully be adopted this December, but we've put out sort of a preview of it, and there's a lot about this that's important to a lot of you in this room, so I thought it might be a good time to preview it. Okay, so the first thing to know about our strategic plan is our life that CIRM has, and there was some debate and misunderstanding over how long the agency may or may not last. Important to know, we will be around for another 5 years, issuing $200 million a year in new awards. So we have a very significant amount of resource to deploy over that period of time, and we'll be doing so. This is what we've done so far, which is interesting to see. So we've deployed $1.3 billion to disease-specific research initiatives, and we currently now have 15 clinical trials. We had 10 in the first 10 years. We've added another 5, and we're only actually been doing it 6 months this year. So we're picking up pace considerably. You can see where the research focus that we've gone into is as well. We have thus far been very, very, very heavily biased towards funding academia, 91 to 9. There's a little context required for this number because there were certain initiatives that we did which could have only gone to academic institutions, such as major facilities. We have 12 of them across the state. But when you take out and you just look at translational clinical stage, it's still 80-20 in favor of academia. Now, the thing to understand about this is it's very important that we pull industry into the business of stem cells, because our mission is to have these things ultimately go on and be able to affect patients in meaningful ways in populations. And we can only do that if we have industry support. So this is showing us that we don't have sufficient industry engagement yet. And so we're going to work on this in a couple of different ways, but the important thing to know how we're not going to work on this is in doing anything that lowers the standard, the scientific bar that it requires in order to get funding from CIRM. We, as part of the exercise, we had to decide whether or not we had the right mission still, or whether it needed to be tweaked or changed. And so this is very important. Our mission is to accelerate stem cell treatments to patients with unmet medical needs. Out of all of the stakeholders we surveyed, 96% of them agreed this was the right mission. More importantly for me, 100% of the board of directors agreed that this was the right mission. So this is very, very important, because this is the one immovable thing that we have going on, right? We will not deviate from this. Everything else we can is fair game to think about how we might want to change or do something. But the mission doesn't change. We always work towards that. Okay, so over the first 10 years, CIRM did some pretty neat things. You could think of the first 10 years as building pieces of an engine, and they're beautiful pieces. We have basically 5 pillars of things that we support at CIRM. We have infrastructure, so buildings, alpha clinics. We have a genomic center. We have an IPS bank. Education, we support research or education from high school through postdoc. And then we have the 3 stages of research: discovery, translation, and clinical. A big shift from the way we were to now, and I'm going to show this in a couple of different slides, is now that we've built these big, beautiful pieces, we need to put them together so they work as an actual engine, not as individual entities. And so that's what we're going to be doing. I just show you an example. We used to do basically RFAs by initiative. And this was because when you go back in time, we didn't have sufficient demand continuously to have these programs up. And so these things would literally pop up. We call it grant whack-a-mole. They would pop up, they would stay open for a while, they would go away, and you wouldn't know whether or not one would come back up again or not. We're now getting rid of that, and we're going and we're taking these pieces and we're putting them together, and we're going to have them run in a continuous fashion. So we're accelerating things as we move along. Just to give you an example, this is what's been approved by the board of directors and is now being implemented. Seed awards in the very earliest stages of discovery, through larger discovery awards, translational, and then the clinical pre-IND, clinical trials, and accelerating activities. These things will be offered once a year, twice a year, and 12 times a year. So you will always know that these programs are open and available to you, and you don't have to worry about when or how if their funding is going to come back. So I want to use just a little bit, a quick analogy here to switch into the strategic plan and how we're thinking about things. If you think about the work we do at CIRM, it's pushing this giant boulder, which is stem cells, over this hill into this happy valley of cures below. Now, the one part of the metaphor that is a little bit tricky is why you would ever want to push a giant boulder onto the people that you're trying to treat. But if you let that part go and imagine it just as a giant boulder of love and happiness, then maybe it works a little better. So we're pushing this giant boulder of love and happiness over the hill. And what we've been doing so far is a lot of pushing. And that we've done, I think, a very good job of at CIRM. But as we looked at this, we thought, we probably could do more. There are probably more ways we could encourage getting this boulder of love and happiness to the other side of the mountain. And so we're actually implementing these three different strategies. One is our pushing machine is going to be a much better integrated, fast, powerful pushing machine. That's this giant engine of all these different things working together. Grants that are always open. You'll know when you can apply. You won't have to worry about them popping up or going away. The second thing is we need to do more to get industry engagement, because we need people on the pulling side of this equation as well. And this would be a lot easier to move this boulder over if we weren't the only ones trying to move it. So we're going to get pulling activities. And then the last thing is the hill is in some places inappropriately high, and it needs to get leveled. And that refers to a lot of the regulatory paradigm around cell therapies that needs to be improved and fixed. Japan has already done this. Europe is in the process of doing it right now. And we need to take a leading role in leveling that hill as well. So if we're successful in this, within 5 years, we will have an additional 50 clinical trials. That'll be 65 total clinical trials in 20 unique diseases. We're going to have at least 5 pediatric, at least 10 orphan indications. We want these things to progress more. We're going to reduce, right now, preclinical development time for a cell therapy is 8 years. It's 3.2 years for that same activity for a small molecule. So we're going to try to cut that in half. Drive better FDA paradigms, and get our programs that we have partnered up with industry. So just to finish up here, what you need to know, so we have now open programs for every stage of research: discovery, translational, and clinical. They're continuous. You don't have to worry about them going away. They're what we call program announcements instead of RFAs, so they're durable. For discovery and translation, they'll run basically every quarter. It'll be a discovery, then a translation, a discovery, and a translation. We are deploying large sums of capital, so these awards are up to $20 million an award. We know it's working faster, so the clinical part of this we introduced in January of this year. We took our what used to be review time from cycle time from 22 months to 100 days, which is pretty good. We have real patient participation in this. This is something that's very important to CIRM. There's a variety of therapeutic options. It has to affect a stem cell, but it does not have to be a stem cell. So that's important. The best deal you're going to get is if you're in California. There's no doubt about that. But if you're not in the state of California, we want you to come here and we want you to do your work here. So just because if you're not a state of California organization, you should still think about looking at seeing what we have. We're ready when you are, so you don't have to try to jam a grant into a slot it doesn't fit. And then lastly, highly competitive. The idea of this is to keep the standard of excellence very, very high and only drive forward that kind of science. So that's the strategy: push, pull, and level. Sticking with keeping it short. I will stop there and be done. Thank you guys very much.